Bismillah ar-Rahman ar-Rahim. Management of massive haemoptysis. Massive haemoptysis means coughing of blood more than 100 ml of blood in 24 hours. It's a life-threatening emergency with a mortality rate of up to 80%, and it's extremely distressing for the patient, relatives, and the medical staff, but fortunately rare. Investigations will follow treatment, which may be difficult and is often unsuccessful, and in some cases, active treatment may be inappropriate, and palliative treatment with oxygen and opiates may be warranted. The management include airway protection and ventilation. Protection of the non-bleeding lung is vital to maintain adequate gas exchange, and this may involve either setting the patient up or lying on the bleeding side. Again, this may involve either setting the patient up or lying on the bleeding side to prevent blood from flowing into the unaffected lung, or intubation with a double lumen tube. If intubation is not needed or not appropriate, give high flow oxygen. Second step is cardiovascular support, including large bore central intravenous access and doing cross match blood and fluid resuscitation plus or minus blood transfusion, correct clotting, as for example giving vitamin K 10 mg OD and give platelets. Inotropes may be required. The third step is nebulized adrenaline, 1 ml of 1 in 1000 made up to 5 ml with sodium chloride 0.9%. Then giving oral or IV tranexamic acid 1 gram 3 times a day, and we should not give it if severe renal failure is present. Also giving IV telepressin 2 mg IV, then 1 to 2 mg every 4 to 6 hours if continued bleeding. Doing chest x-ray plus or minus chest CT depending on stability of the patient. Doing early bronchoscopy, which has diagnostic and therapeutic rules, and rigid bronchoscopy with general anesthesia is preferable over fiber optic one. Rigid bronchoscopy may allow localization of the site of bleeding and inserting balloon tamponade with a foreign or with a Fogarty catheter. Bronchial artery embolization, which is sometimes very important to embolize the bleeding artery, usually with coils or glue, and needs specialist center only. Surgery, by doing a resection of the bleeding loop if all other measures have failed. So we can summarize again the treatment of massive haemoptysis as follow: airway protection and ventilation, either by setting the patient up or lying on the bleeding side, or doing intubation with a double lumen tube. The second step is cardiovascular support, include insertion of large bore or central IV access, doing cross match blood, fluid resuscitation, correct clotting, giving nebulized adrenaline, giving IV or oral tranexamic acid, giving IV terlipressin, doing chest X-ray and or chest CT, early bronchoscopy, and the rigid one is preferable over the fiber optic one, bronchial artery embolization, and last choice is surgery when the previous management fails. That's all. Thank you.